Hello and welcome to Rhode Island. My name is Dr. Christopher Patty, and I'm the Chief Resident here at the NYU Langone Dental Medicine Advanced Education and Pediatric Dentistry Program in Providence, Rhode Island. I'd like to take some time today to talk to you about the Providence, Rhode Island site. The leadership of the Pediatric Dentistry Program is led by Dr. Daniel Kane, who is the director of all NYU Langone Advanced Education and Pediatric Dentistry sites. We at Rhode Island have the absolute privilege of working closely with Dr. Kane as he is primarily based out of our site. It's a pleasure building a relationship with him, and he's an invaluable resource to have throughout residency. The Pediatric Dental Residency Program are sponsored by NYU Langone Health. Dr. Kane is supported by 3 senior associate directors, each responsible for different regions in the country: Dr. Adia, Dr. Akalesh, and Dr. Akuji. There will be numerous times throughout residency where you have the opportunity to speak with these directors on different occasions. Locally, there are also associate directors that are located at each of the individual training sites. We at Rhode Island are lucky to have Dr. Yamir Yavari as our associate director. Rhode Island was the first satellite site developed for pediatric dentistry, and it was launched at our main site, St. Joseph's Health Center, in 2003. Our current second year class is comprised of 4 residents. There are 5 residents in the first year class. Each of our residents have their own and unique reason why they ranked our site. Residency can be demanding at times, and having a strong group of support system around you is key to getting through it. Our Rhode Island program includes 4 different locations. The first site, and the site that you'll spend the majority of your time at, is St. Joseph's Health Center. There are a wide variety of services that we offer here at St. Joseph's Health Center. Our residents graduate from our program ready and qualified to walk into a private practice with how much clinical experience and exposure to different situations you will receive here. We have amazing faculty here. We have about 1 attending per 3 to 4 residents at a time. We're so grateful to have all of our attendings. They've made such a great impact on our program, and it's easy to see that they love to teach. They always make themselves available during and after hours for any questions or concerns that we may have. At St. Joseph's Dental Center, morning huddle starts at 8 a.m., and your day will end around 4:30 to 5 p.m. Each resident is assigned their own room. Portable nitrous tanks and protective stabilization boards are available if needed. We have phosphor plates in the clinic and digital radiographs in the OR. We also have handheld nomans that are available if needed. You will also work closely with our oral surgeon, Dr. Urkel, at St. Joseph's Dental Center. You'll get experience with canine exposures, wisdom teeth extractions, biopsies, frenectomies, among others. We also hold a suture workshop at the beginning of the year with the oral surgeon. It's a great way to bond with your new residents and get a refresher before you go on call. On Monday mornings, we have the pleasure of working with 2 different orthodontists. Some Mondays, we attend lectures at their private office, covering topics including space maintenance, habit appliances, full ortho cases, and more. One thing that may be unique to our site is our craniofacial experience. Thanks to previous graduates of the program, we are able to get experience with the treatment of cleft lip and cleft palate. You will learn how to make and adapt NAM appliances and potentially have the opportunity to follow patients all the way through surgery with their plastic surgeon. You will also get significant experience in treating patients with special healthcare needs. At St. Joseph's Dental Center, our administrative staff consists of a dental manager, an educating coordinator, and a clinical coordinator. Many of our dental assistants are certified interpreters, and you will always have access to the language line translation services if needed. We also have an amazing front desk staff at St. Joseph's. They will handle calling and confirming all of your patients, as well as handling most of the paperwork associated with your visits. This will make your life so much easier and give you the ability to focus on patient care throughout residency. The next site that I'd like to talk about is Our Lady Fatima Hospital. This is where you have access to our OR dental suite. You will do all your general anesthesia cases here, as well as your oral conscious sedation cases. It's a huge blessing to have our own dental suite here that is always available for use. It is also a great advantage to be able to observe and operate oral conscious sedations in a hospital setting. You will learn which medications to use, how to manage patient behavior, and how to handle emergency situations. This is also where you will do your 20-day long anesthesia rotation. On this rotation, you will work closely with student CRNAs, and anesthesiologists. You will learn how to intubate, how to bag mask, how to start IVs, among other skills. The next site I would like to talk about is the third site that you'll be at during residency. This is Rhode Island Children's Dentistry and Orthodontics. This is a private office in East Greenwich, Rhode Island, where Dr. Gordon, Dr. King, and Dr. Paquin have generously volunteered their time and allow us to visit and learn a variety of things here. Dr. King and Dr. Paquin are former graduates of the NYU Langone site in Rhode Island, and you will get training in NAM and laser dentistry with both of them. The fourth and final site that I'd like to talk about is Hasbro Children's Hospital. Hasbro Children's Hospital is a level 1 trauma center, and here you will gain a ton of experience managing a variety of trauma situations. I'm sure you're probably curious about call. Residents are on call for 1 week at a time, Monday through Friday from 4 p.m. to 8 a.m., and weekends and holidays from 8 a.m. to 8 p.m. Call is not in-house, and therefore you're required to live within 20 minutes of the hospital in order to respond to call in a timely manner. You'll never be on call by yourself. A second year and a first year will always be paired up. Until about December of your first year, you will go on call with a second year. After that time, first year students will be considered on first call, but they will always have a second year in the event that they need assistance. At Hasbro, you'll become very experienced and comfortable handling traumas. Here are just a few to show you what you might see while you're on call at Hasbro. You will definitely see avulsions, lip lacerations. These are some of the most common things that you might see. You'll get ample experience in repositioning and splinting teeth as well. Facial swellings are also a common reason you'll be paged. Many times, following the management of these patients in the ED, you will then establish long term comprehensive care at St. Joseph's for these patients, as many of them do not have a dental home. Hasbro Children's Hospital is also where you will gain additional experience in sedations. You will have intranasal Versed as well as IV ketamine for situations where treatment may be too complex given a patient's behavior. Perhaps just as unique as our craniofacial experience, you will also have experience treating refugees with the help of Dr. Lewis in the refugee clinic at Hasbro Children's Hospital. You will help triage and establish continuity and comprehensive care for these patients, many of which have never seen a dentist in their life before. In your second year of residency, you'll have the opportunity to be part of the LEN program. The LEN program is a leadership in education and neurodevelopmental and other related disabilities programs. This will consist of weekly seminars and trainings in which you will hear from doctors, educators, and family members to better understand how to serve patients with disabilities. You will also get teaching experience while in residency. During your second year, you will be going to Tufts 4 to 5 times during residency to help teach the undergrad dental students there. Here's a look at your clinical requirements broken down by each year of residency. At this site, you will have absolutely no issues fulfilling these requirements. This is a typical schedule for a first year student. You can see we have ortho clinics in green on Mondays, generally 1 to 2 days in the OR a week, although that fluctuates, as well as various rotations such as anesthesia seen in gray. Here's a look at a second year schedule. The schedule stays about the same. However, there will be several rotations, including refugee clinic, teaching rotations, craniofacial rotations, sickle cell inpatients, among others that need to be squeezed into the schedule. And just like every other NYU Langone site, there's a didactic portion where one day of the week you will need to meet for video teleconferencing where all sites log in and listen to the same lecture on a variety of different topics. Each resident will be assigned modules that are due on a monthly basis. Additionally, we also have literature review that occurs anywhere between once and twice a week. Many of the NYU Langone site graduates have been recipients of awards throughout their education. And our pass rate for the qualifying exam and attaining board certification are greater than the national average seen here. Here's a breakdown of the stipend that you receive during residency. There is similar pay across both years with a slight increase in the second year for whoever becomes the chief resident. You will also get a stipend in their first year for books and a stipend to cover the cost of the qualifying exam in your second year. I think you'll find that Rhode Island has so many things to offer outside of residency. There's a lot of affordable housing options available within the 20 minutes to the hospital, depending on if you're single, married, married with kids. Whatever your situations, there'll be definitely a place that you can find that'll be comfortable. There are great restaurants in Rhode Island, great coffee shops. There's tons to do on the weekends. I hope this helps you get a better sense of the program here at Rhode Island. We all appreciate your time and interest with our program, and we wish you the best of luck in the application and interview process.